But I always
Well,
figured.
I think we can go ahead probably and get started. It's just one after here, but people will probably hop on. We are recording this session, so if you ever need to reference it back, or anybody who's not able to be on the call, they can reference back as well. And then in the chat, I will put the link to our benefits page where you can access it next week if you ever need to reference it back. And then if everybody could just mute, I'm going to hand it over to Leora. She is our account manager over at Medica, and she's been with us, working with us for many years, so she's
Yes.
very familiar. And I'll hand it over.
All right. Well, thanks so much, Leah. I appreciate everybody taking the time. And as Leah mentioned, what I'm going to be doing is going over the medical benefits that are effective for 1/1 of 26. So, this is kind of your open enrollment period information. So it's your time if you're maybe new and you want to sign up for benefits, or if you're currently on the plan, you have an option, to switch plans. So hopefully everybody will find some information helpful for them. So maybe a little nugget if you've been on the plan. I'd like to say that I'm happy to announce that you are renewing with the same 3 similar plans. So again, for those of you who have been on the plan, there might not be a lot of new information, but you can always pick up some nugget that hopefully, because there is usually so much information. But the 3 plans that are being offered, again, is the Medica $2,000 deductible, $30 office copay or $30 copay, 20% insurance, co-insurance. And then there's 2 HSA plans, which is the 4,000 deductible, 20% HSA, and the Medica 5,500 deductible, 25% HSA. So the HSA plans are in the yellow and kind of the purple color there. And you can see that those are high deductible. So they are eligible for you to set up an HSA account, which is basically stands for a health savings account, which is kind of like a bank account for money that you can put in there tax-free, and you can use that money when you have health care expenses, because a lot of the benefits will be going till you satisfy your deductible. So you could use that for amounts that you have to pay that go towards your deductible. So the main difference that kind of differentiates the 3 plans is the first plan that I mentioned, that 2030. That plan has a deductible, but it doesn't apply on all services. There's a lot of services where there's just a copayment and you don't have to meet the deductible. So that's kind of the main difference, is there are some benefits that you just have a copayment without having to meet the deductible. So it's a little bit richer benefit plan on that. I'm going to be going over all 3 of these plans. You can see this kind of side-by-side summary to kind of help you look across, to kind of compare the benefits, to help you maybe make a decision. But these are just in-network benefits. I want to point out all 3 plans do have out-of-network benefits. If you're outside the Medica service area or outside the service area for the ACO network, if you're there are benefits outside the network, but those are more expensive and will cost a lot more out of your pocket. So we strongly encourage you to use the network that you choose. So whether, and I'll go into more detail with that, but again, there's these 3 medical plans, so you can pick between one of these 3 plans. And then there's some network options that will be available for you. So the first plan has a annual deductible. There's a 2,000 per person and a 4,000 per family, versus the 4,000 deductible has a 4,000 per person deductible and an 8,000 per family. So it doesn't matter how many members you have in your family. If you have 6 or 8, it's one family deductible. Versus the 5,500 is a 5,500 deductible per person, or 11,000 max per family. The preventive care on all three plans is covered at 100%. So be sure to go in and get your routine physicals, your routine eye exams, mammograms, pap smears, all sorts of your preventive services. So because that's covered at 100%. I do want to note that sometimes people will go in for a preventive service, and then maybe there's a diagnosis, or if you have some other kind of treatment that's not billed as the preventive, say your routine physical, then that may apply, like your office copay for those services that you have. But if it's billed just strictly as your routine physical and eye exam, then it's covered at 100%. Convenience care is a $15 copayment on the 22,000 deductible versus it's after deductible, and then it's 20 and 25% coinsurance that you can see on the health savings accounts or the HSA plans. The hospitalization is one place on the 2,000 deductible plan. That's the plan that does have copayments where you see that the deductible does apply. So if you had an inpatient hospital visit on the 2,000 plan, it would be subject to the deductible, and then it's covered at 80%. And then the other two plans are, again, after deductible, you can see them covered at 80 or 75%. So you would have a 20 or 25% copay after your deductible is met. So if you had a real expensive hospitalization and you met your deductible or your out of pocket, which I'll be going into, then you'll have 100% coverage for the remainder of the calendar year for any eligible expense. Prescriptions is one other area too, where it's a little bit different between the HSA plans and the copay deductible copay plan. So in the teal, again, the prescription drugs, there you're just going to pay a copayment for your prescriptions, where if it's a generic, it's $12. If it's a preferred brand, it's $50, and non-preferred brand is $90. Versus the benefits on the HSA plans, it would be subject to the deductible, and then either the 20 or 25% coinsurance. For preferred or non-preferred benefits, it raises up to 40% after the deductible on the 4,000, and then 45% coinsurance after deductible on the 5,500. There isn't like an HSA preventive drug list, so there are some drugs that are covered at 100%. So I would recommend that, and a lot of doctors will, if you, let's say you take a high blood pressure medication like lisinopril or something like that, for prevention, like high blood pressure, that's covered at 100%. So sometimes that's a good option to use those drugs if possible. And emergency room is subject to deductible, and then the 20% coinsurance you'll see on the 2,000 and the 4,000 deductible plan, and then it's after deductible 25% coinsurance on the 5,500 deductible. The out-of-pocket maximum is what I like to say is just basically your worst case scenario in a calendar year. So as I mentioned, if you have a hospitalization, or like it's basically like one, I like to think of it as one bucket of money for services that you have paid. So for instance, if you have a copayment, like an office copay, and let's say you're on the 2,000, that $30 copay, that would go into that bucket of what you paid. Or if you paid, money towards your deductible, that would also go in. So your deductibles roll into that bucket. So on the 2,000, for example, let's say you're a single person and you have a $2,000 deductible, and you met that would roll into your out-of-pocket of 4,000. So now you only have to do $2,000 more worth of expenses to get that 4,000 met, and then you have 100% coverage. so it's kind of nice. There's just kind of one max for your, again, if your deductible goes in there, any co-insurance that you've paid, or any co-payments. And so with these three benefit plans, when you decide what benefit plan you would like to choose, then you can choose a network. Medica Choice Passport is offered on all three benefit plans. Passport is our largest network. You don't need referrals. You can, you don't need to get like a referral to go to a doctor that's in there or work through a particular clinic. So there are, thousands of providers on this plan. And there's also nationwide coverage. So no referrals needed to access, primary and specialty care providers in this network. And so when you are in the Medica service area, you can see the colored states there, like Minnesota, the areas of North Dakota, Western Wisconsin. You use the Medica Choice providers. And if you're outside of the Medica Choice network, let's say you're down in Florida or California or New York, you would use the United Healthcare Choice Plus, or the Passport piece of the plan. There's a network that's national, and if you went to one of those doctors, you would get in-network benefits, just like you were here in the service area going to a Medica Choice provider. And all three of the plans that do have emergency benefits. So, if you're out of state or out of the service area and you have an emergency, you would just go to the nearest hospital, and that your emergency benefit would fall under your in-network benefits. Another option that you can choose, which will be less expensive, but it's still a decent sized network. It is a big network. M Health Fairview and North Memorial Health. These providers are in that Passport network. But if you decide to go with the Vantage Plus, then you would need to go seek your care with M Health Fairview or North Memorial Health. And you can see on the chart here in gold, those counties, like, and it's really like a Hennepin, more of a metro-based, where the providers are. So if you live in these counties like Hennepin, Wright, Isanti, Anoka, Chisago, Washington, Scott, and Dakota and Carver, that's where Vantage Plus providers are. So it's a good option for people that live in these areas if you want to save some money and have a smaller network. Then it's a good option. They also have some other perks, such as the nurse advisors that are available 24/7, same day, and virtual appointments. So it's some little perks for being in this is called an ACO, or it stands for an Accountable Care Organization, which means Fairview and North Memorial would be accountable for your care, and you would seek your care there. The next option, and so this Vantage Plus would be eligible on all three of the plans. And then the next option would be Clear Value with Medica. Now, this is a very small network, so I want to point that out. And so maybe like a niche for some people that, maybe you're very healthy and you don't need to see a lot of specialists or doctors, and quite frankly, you're only maybe go for your preventive care each annually, then this might be a good option if you live in this area. But it is, the smallest network, which would be Hennepin, Anoka, and Ramsey. And there's 8 primary care clinics across Hennepin County. And so it is not that large, you can see, but for some people, it might be a good fit that, really don't need to have a lot of access to specialists or that kind of thing. So if these clinics work for you and you live in that area, it could be a great option to save money. The Brooklyn Park Clinic and Pharmacy Clinic and Specialty Center in Minneapolis, East Lake Clinic in Minneapolis, Golden Valley Clinic, North Loop Clinic and Pharmacy in Minneapolis, Richfield Clinic and Pharmacy, St. Anthony Village Clinic and Pharmacy in Minneapolis, and the Whittier Clinic and Pharmacy in Minneapolis. So it is kind of a real niche for that area. And the clear value I did want to mention is that network is only offered on the 5,000, the 5,500 deductible plan. So wanted to point that out. And then where to go for care. So there are lots of different options that people can choose to seek care. And, you know, it's kind of like the restaurant, from zero cost, you can see here, to the higher dollar cost. So the lowest option on the left being Medica Calling. That phone number is on the back of your card. You can talk with a registered nurse free of charge, so that you can get advice there. And so that's free. There's virtual care and convenience care clinics, which are more expensive than the free advice, but less expensive generally than the office visit. And then usually the urgent cares are more expensive than the office visits. And then with the most expensive being going to an emergency room. So you do want to be a good steward of healthcare dollars. So if you don't have a true emergency, you don't want to go to the emergency room. But by all means, if you do have an emergency or have a heart attack, do get to the nearest hospital emergency room. For your pharmacy benefits, we have Express Scripts, which is the pharmacy benefit manager that manages our prescriptions. And it is a huge network with 64,000 or more retail pharmacies. So you're going to find a pharmacy that will be convenient for you. It's the big, you know, box offices, the Walgreens, the CVS's, that sort of thing. But it also has a lot of smaller pharmacies as well, little mom and pop pharmacies. And so it's a huge network. There's a mobile app Express Scripts has. So if you want to download the Express Scripts app, you can check your drug costs. You can find a pharmacy. You can get drug information and related alerts. And then there's a Credo, which is our specialty pharmacy. Now, the specialty pharmacy, you would know that if you were on a specialty drug, they are very expensive. They're usually high tech. They might be injectable. Let's say you have Crohn's or that sort of thing. They may need to be refrigerated. So they may require very specialized handling. So those are handled through a Credo specialty pharmacy. And Medica also has a lot of member resources to help you with your plan and get information. We do have the Medica member portal where you can log into the medica.com/sign in. You'll set up a user code and password. We also have the mobile device, so you can do it from your mobile device as well. And so you can get access quickly to your information. You'll be able to download an ID card to your mobile wallet. You can check your claims. They'll have your certificate of coverage out there. So, you kind of just got like a little snippet of the different benefits, but there's a lot more, and that would be in your certificate of coverage, which will be posted out there. So, and it's nice to look to see if you have a question on if we received a claim, what Medica paid on it, what would be your responsibility. You can check where you're at with your deductible and out of pocket. It'll track that for you. So a lot of good information, and you can get into our wellness benefits from there. So there's a lot of good information out there for you. We also, as I mentioned, the Medica Calling, that is that phone number where you can talk with the registered nurse. So so maybe you've been diagnosed with something and you have some questions, and maybe you need help finding a provider. You can talk with a nurse 24/7. And especially it's in the middle of the night, you get sick, your baby gets sick. It's nice to just be able to call and talk through some situations. there's another option for care is, there's clinic-based options where a lot of doctor's offices have some virtual care or online with your, doctor's office. Or there's also Amwell or Virtuel. And so Amwell and Virtuel are very similar. However, there are some differences. Amwell is 24/7 online clinic, and it serves all states, where Virtuel is in select states. And Amwell also offers some coverage for behavioral health or mental health. And those prices would just vary depending on the situation. And typically they're $79 or less if your plan option, if the benefit is less. So sometimes a good option, cheaper sometimes than an office visit copay, but the convenience of maybe doing it online if you're sick and you don't want to go into the doctor's office. There's things that maybe you have pink eye or that sort of thing. They could send a prescription right to your pharmacy, and you don't even have to go into the clinic. So you can just kind of do it from your bunny slippers at home. So sometimes kind of nice. We also have an employee assistance program called Medica Optum Emotional Wellbeing Solutions now. And this is a wonderful program, free of charge for you to call, but they can help with so many things. If you're trying to find a daycare provider, they'll do the legwork for you in the city you're looking for licensed daycares. Or if you have any kind of problem, concern, financial stress, retirement issues, they have people that are very qualified to help with the issue that you're calling about. So one thing I like to point out too, because mental health just seems to be rolling by leaps and bounds, and it's so important to take care of your mental health. So we have so many different options now to assist people. But you do get 5 counseling sessions per issue per year, covered at 100%. So that's really kind of a great free benefit. And so let's say you called Medica Optum, and they will give you, kind of a code. You get your 5 sessions. What's really nice is a lot of those counselors that you get are also in the Medica Behavioral Benefit network for the benefits on your plan. So if you use up your 5 and you're not done, you still are working on that same issue, a lot of times it's just a smooth transition to stay with the same counselor. So that's really kind of a nice feature. And again, this is kind of just a screenshot of your talking about your 5 free counseling sessions. So that's the EAP number, and that number will also be on the back of your card, and you can talk with a specialist. And the counseling sessions can be virtual or in person. If you need help, finding a provider, they can, help with that. So you can either look online, or again, you can call the Optum number. So the behavioral health, which is the network that handles our mental health, and you can see there's a phone number there, the 1-800-848-8327. And they have specially trained staff that can get you the right care when you need it 24 hours a day. And so if you need help, again, where to go, that sort of thing, it's they're there to help. And otherwise, you can go online at the Live and Work Well website and find providers that way as well. For the behavioral telehealth visits, again, we talked about Amwell, and you can just download that free app from the App Store or Google Play. And that's where you can, work with therapists. Again, they do provide some mental health services as well. But there's also a Talkspace is another behavioral telehealth visit where you work with a licensed therapist anywhere, anytime, send a private message or text, voice, or schedule live video sessions. So you can just go to Talkspace.com/connect. Also another option for you. So a lot of good options. And then there is a self-help app called Self-Care by Able To. And this is a app that you can use, and it provides you with tools to help. Maybe you have some stress, anxiety, or depression, and to help you work through that. You do need to be 13 years of age or older to be part of that behavioral health. But you can go to able2.com/begin and then just choose getting started and enter the Medica for access. And this is a screenshot that'll show you what it will look like on the mobile app, the Self-Care by Able To. And, you'll just need to, after you, get started, enter some information on there. And it does say to note that for members, you should set up your Self-Care by Able To account before you download the app. And then as far as wellness programs, Medica really incents people to try to stay healthy and, live your best life. So no matter where you start on the spectrum. And so we do have programs that come, again, free of charge for you. If you sign up for the 2 high deductible plans, the 4,000 or the 5,500 deductible HSA plans, then you as an employee, and again, employee only, would be eligible to participate in the My Health Rewards Invest program. I'm going to be talking about another program, but this one is specifically for the employees that take the either one of the HSA high deductible plans. And basically, what you would do is you will track you'll need like a Garmin or, a Fitbit or an activity tracker that, and there's a whole list of trackers, the program that will sync. So you just need to get one that would syncs with this program. There's sleep. So you'll track your sleep for more. If you sleep for 7 or more hours a night for 20 days in a calendar month, then you would get $25 for the month. If you track a healthy habit for 20 days in a calendar month, then you can earn another $25 for that. And if you take 10,000 steps for 20 days in a calendar month, you earn $25 for that. So in total, the most you could earn per month is $75. And if you earn the $75 per month for the year, that would be a grand total of $900 per year. So Medica will reimburse quarterly to your employer the money that people have earned, and then they will deposit it into your HSA account. So kind of a great way to earn money and keep you active and healthy. And hopefully, once you do habits and, learning to, walk 10,000 steps a day, you hopefully can just keep that on and it becomes, second nature and easy to do.
I'd just be amazed if I could get 7 hours of sleep a night for 20 days in a month. That'd be fantastic.
You have to kind of work at that, but it's good when it makes you try to. And so this is just a screenshot of the mobile device. So how to register, download the Personify Health app. Personify Health, it used to be called Virgin Pulse, but now it's Personify Health. And you would just go into the My Health Rewards Invest. and then you can sync or connect your device, and then it'll track, like I said, your activity and your sleep, and then you get rewarded, as I mentioned, the up to $75 per month into quarterly into your HSA. Now, the next program is, this program comes with the $2,000 deductible plan, and it's available for the dependents only of the employees that chose one of the HSA high deductible plans, the 4,000 or the 5,500 deductible. So if you're a dependent on the HSA plans, you do need to be 18 years of, they need to be 18 years of age and older to participate. So a lot of times, college students, but they really love to do it to earn the money. And then again, it would be for employees and their dependents on the 2000 plan. This program is a little bit different. It's a point-based program, and you get rewarded for healthy activities. So again, you can track physical activities, and so you can sync a device as well on this one. And you can track sleep. You get $5 for a preventive checkup, and you can basically earn like e-gift cards. And there's a ton of places that you can choose for your gift card. There's also like a store where you could buy something like a tracker or different wellness items out there. So it's a great program where you can earn money and get moving and healthy. And this is kind of just a screenshot too. So basically, it's still powered through Personify Health app, but instead of the where you would click on the invest, you're going to be the My Health Rewards program. So you'll see on step number 3, My Health Rewards, but basically kind of the same thing. You'll need to register, and you can just do that by downloading the Personify Health app from the App Store or Google Play. And then we do have a program to help people that maybe have to, shed excess weight or lower, the risk for getting chronic conditions. So maybe you've been diagnosed as pre-diabetic, but you don't have type 2 diabetes yet, but maybe you're pre-diabetic. And so this program is to help ward off, getting to the type 2 diabetes. So you wouldn't be eligible for this program if you are already a diabetic type 2, because you'd be working with your doctor and all that monitoring. This is more of just trying to change lifestyle to prevent moving to the chronic condition. So if you do get accepted, say for the weight loss, you would receive a free scale and a dedicated health coach and care team, kind of guidance tailored to your unique needs. 10 minutes a day, achieve a healthier lifestyle at your pace, anytime, anywhere. So great little program to help people ward off chronic condition.
And real quick, I'm just going to touch base on this program as well. I've utilized it myself, and I got my scale and all my fun things. And they have really great programs where you can, group programs as well. And the coaches give you a call, and you work together. So it's a very nice program to work with.
Thank you for saying that. Yeah, it's always nice testimonial when people use it and it works, for them. So. And then how to do it is after your plan's effective date, you just go to amadahealth.com or amadahealth.com/Medica, and then you complete the questionnaire if you're at risk for certain chronic conditions, again, prediabetes or cardiovascular disease. And if you're eligible, enter your contact information to complete your enrollment. And another app. I don't know what we did with it before for apps. I'm telling you, we didn't have as much information as our fingertips. There's Ovia Health. So Ovia Health, there's 2 apps, and they deal with like whether you're maybe starting a family or you're trying to get pregnant or you are pregnant or you have kids. They also now have offer managing menopause and perimenopause information. So back in our day, if you're as old as me, you might have had like that book, like What to Expect When You're Expecting. I think everybody got that book to learn. And now you have this app, so it's right at your fingertips, free of charge. And back in the old day, we were talking with my coworker, and she said people just would call like their grandma or somebody that had 13 kids because they figured, they had that many kids, they knew what to do. So this is really kind of a great little app. So you can download again Ovia Health from the App Store or Google Play. And then, you can choose what you want, if it's Ovia or the Ovia Parenting, and choose that you have Ovia Health as a benefit during your sign up process. And that is it on there. So does anybody have any questions?
I see Avery typing.
Mhm.
Can you explain how to compare coverages and costs between Medica and state health care like Blue Cross Blue Shield?
That we don't have anything like that. Yeah, tool like that.
Any other questions?
But the best probably, just check if you're checking other options out, is just check with them and then compare it against your costs for your employer health plan.
Of course.
But they could always provide you with something too if you're looking for an individual or MNsure or something like that.
I'm also posting in the chat feature the benefits link, which if you click on that will open up both the benefits summary as well as that rate sheet. Gary, I think that's what you're looking for, the rate sheet with the premiums. They are not changing this year. So this rate sheet, although it does have 2025 on it still, it is still accurate. And then we will be posting up a new open enrollment meeting in with this year's meeting on this page as well. And then Erin's asking if there's some time that people can set up Medica where they can explain the circumstances and advise on which plan is best. Leora, is that something that Medica offers?
There really isn't a best, option for, it would depend on, your individual needs, as far as like what options to choose. But I think the best advice is just you would look at, what types of, medical expenses you have. So if you, like I said, need to see or want the option to see a lot of providers, that sort of thing.
Yeah, I will say real quick, Alina and Health Partners, they're only going to be in the Choice Passport option.
Yeah.
The two more narrow networks are pretty narrow as far as the clear value, but the Vantage Plus, that has both Fairview and North Memorial networks. So those are pretty, broad and big networks as well, but they do not include Health Partners or Alina.
And then when you look at the plans too, I think the 2000 would be the more expensive one. So it depends if you prefer to, like on your prescriptions, just pay like a copay, or you want it, maybe you're just a person that has 2 office visits during the year or something like that, and you don't want to, pay for them to have it go to the deductible, and you just want to pay the copay. So some people like to pay more, but then no, for, office visits and, convenience care, that sort of thing. I just have a copayment, and prescriptions, just a copayment. but the high deductible plans, a lot of that is, you need to meet that deductible first, so you're paying, higher costs until you've met your deductible, and then, kicks in. And so kind of just depends. It's an individual preference on, are you okay with, like, a lot of those benefits? You have to get to that higher deductible, but you do have the ability to, fund your HSA account to use that, where some people just like to know, well, okay, with the exception of like the bigger items like the hospitalization on the 2,000, you would have the deductible there, but there are a lot of more co-payments like prescription or like the office visit co-pay. So some people just like to have that they know it's a smaller fixed amount.
Yeah.
And then the other important thing, I think, is just look at the worst case scenario, the deductible and out of pocket. How comfortable are you with a 5,500 deductible versus a 4,000? Is that getting too high for you? And then, your premiums, look at that versus, and how you want to, what kind of plan would
Sure.
best fit for you. But
Yeah. Real quick, I'm just going to try to answer these questions. So Aaron asked if this plan includes vision or dental. It does not include vision beyond a exam. And then it does not include dental. That is separate with Delta Dental, and the rates are the same. The plan is the same. The Delta summary of coverage is on that website that I loaded up. So you could take a look at that plan. And then Avery asked, in the rate sheet, it has monthly deductions. Yep, so that would be split between the first 4 pay periods of the month. There's a couple months with 5 weeks, and that last week you'd get a little extra in your paycheck, no deduction there. And then Gary's asking, with the copay option, if you have an office visit that includes blood tests, is that extra or part of the deductible? Laura, can you answer that?
and if you have a blood test could you repeat that?
Oh, sure. So with the copay option with the PPO plan, if you have an office visit that includes blood tests, is that extra or part of the deductible? So I think it would
You
be
would
part
have
of,
the office copay, so
yeah,
if it was, just part of your office visit.
right. Yeah. If it was in the PP or the HSA
HSA plan.
plans, yep, then that would be an additional charge likely.
Mhm.
Any other questions? I'm not seeing anyone typing, so I am going to assume that either your questions are answered or you have, um, or you can reach out to me directly as well. And Erin, if you would like to talk through the different plan options, I'm happy to discuss with you in more depth. Feel free to reach out. All right.